Welcome to the deep dive. Today, we're really pulling back the curtain on something many of us might go through but don't often see laid out quite like this.
Yeah, we've got this fascinating document here. It's called an admission protocol for patients, elective surgery. And it's very specific. It's from a particular vascular surgeon, Dr. Gregory Weir.
Right, not just some generic hospital form. This is like a step-by-step playbook for the staff looking after you if you're coming in for planned surgery with this specific doctor.
Exactly. It even lists his credentials, MBCHB, MMed, all that, and his practice info. So it's very grounded in a real-world setting.
So our mission today is basically to walk through this protocol together.
Yeah.
We want to understand the key steps, why they're important, almost like you, the listener, are preparing for this yourself.
Mm-hmm. It's about demystifying that pre-surgery process, right? Maybe turning some of that, natural anxiety people feel into more of an informed awareness.
Definitely. Understand what's happening behind the scenes.
Yeah, seeing the instructions that aim to get everything perfectly lined up before you even head towards the operating room.
Okay, let's dive in then. It all kicks off the moment you arrive, right? The protocol starts with something fundamental, patient identity.
Absolutely. Foundational safety check. They'll use your hospital sticker, they'll ask you your name, maybe check with your family if they're there. Seems basic, but absolutely critical.
Can't afford mistakes there.
Wait, it's the first step to making sure the right person gets the right surgery.
And interestingly, right after that, there's a note for the staff. It tells them to welcome the patient and family and assure them that we are honored to help the patient.
Which is a nice touch, isn't it? A bit of human connection in a very clinical document, acknowledging it's a big deal for the patient.
So it's a good tone. Okay, so identity confirmed, welcome extended, and then we get into the initial medical checks.
Yeah, this is about gathering baseline info, making sure you're set for what's coming. It mentions routine blood tests, following what they call the Lancet protocol, which sounds like standard pre-op stuff.
Standard blood work. Makes sense.
But then it lists other possible investigations, things like a chest x-ray or CXR, and some pretty specialized vascular imaging. Duplex Doppler, MRA, CTA.
Okay, MRA and CTA. Those are scans to look closely at blood vessels, right?
Okay.
Magnetic resonance angiography and computed tomography angiography.
Exactly. But here's the key thing the protocol points out. These more advanced scans only happen if Dr. Weir specifically asks for them.
Ah, so it's not a one-size-fits-all approach.
Not at all. It shows the process is tailored. You might need them, you might not, depending on your specific situation and the type of vascular surgery planned.
Right, customizing the prep. That makes sense. Okay, so moving on, the protocol really digs into the nitty-gritty of preparing the patient just before the surgery itself. This seems like the core of it.
It really is. And some of the first instructions are things you often hear about but are absolutely vital, like the patient must remain nil per mouth from admission until surgery.
Okay, so basically nothing to eat or drink. That's the standard pre-anesthesia rule, isn't it?
Yeah.
To prevent aspiration during the operation.
Precisely. Empty stomach is key. Then it gets super specific about physically preparing your body. They mention applying an oxygen mask.
Yeah.
And it specifies 40% O2 mask at 5 milliliters. Not just give oxygen, but a very exact concentration and flow rate.
Wow, that is specific. And what else? I see putting in an IZ line and starting fluids.
Yep, another key step, and again, very precise. 0.9% ACL, that's normal saline solution, at 60 milliliters. And there's even an adjustment. 80 millimeters if weight more than 100 kilograms.
So they're carefully managing hydration, even adjusting the fluid rate based on your body weight. That's quite detailed.
It really shows the level of careful calculation involved.
Okay, so the body's being prepped. What about monitoring? How are they keeping track of things?
Constant vigilance. The protocol says to assess vital signs every 60 minutes. That's hourly.
Hourly checks on.
Blood pressure, heart rate, breathing rate, your SpO2, that's the oxygen level in your blood and temperature. Regular checks to catch any changes early.
Makes sense. And related to that, I see something marked critical here. It really jumps out.
It does. It reads, do not apply a blood pressure cuff or do venipuncture on the affected limb.
Okay, venipuncture is drawing blood, right?
Yeah.
So no BP cuff, no needles in the limb they're going to operate on. Why is that so critical, especially in vascular surgery?
Well, think about it. For vascular surgery, that limb often already has issues with blood flow, or it's precisely where the surgeon needs to work. Putting a pressure cuff on it could, squeeze it and potentially reduce blood flow even more, maybe even damage delicate tissues.
Okay. And the needle sticks.
Same idea, really. Drawing blood could cause bruising, maybe bleeding, or even introduce a risk of infection right at the site they need to keep clean and accessible for the surgery. It's all about protecting that specific area.
So it's a direct instruction to avoid interfering with or potentially harming the surgical site or the compromised limb. That level of specific warning makes total sense now.
It really highlights the specialized care needed. Beyond that physical prep and monitoring, the protocol also covers getting all the essential information locked down.
Like allergies.
Exactly. Assessing and documenting any allergies. It gives examples like iodine or antibiotics, obviously crucial to avoid dangerous reactions.
And also checking current medications. It mentions anticoagulants, antiplatelets, basically blood thinners.
Yeah, absolutely vital. These meds massively affect bleeding risk during surgery, so the team needs to know exactly what you're taking and manage it carefully.
It's all about building that complete picture of your health status right before you go in.
Definitely. And it covers giving pre-op meds too, like things the anesthetist prescribes to help you relax or prepare for the anesthesia itself.
Okay. What about blood for transfusion? Is that standard?
Interestingly, no, not standard according to this. It says ordering blood should only be done if specifically requested by Dr. Weir. And it gives an example, e.g. aorta aneurysm surgery. So it seems like a contingency. They prepare for it only in specific types of surgery where significant blood loss might be a higher risk.
So again, it's tailored to the procedure, not just ordering blood for everyone.
Right. It matches the preparation level to the potential needs of that specific operation. It's efficient and targeted.
This really breaks down the whole pre-op phase into clear parts. Getting the body ready, keeping a close eye through monitoring, gathering all the vital info, and having plans for specific scenarios.
It does. And woven through all these clinical steps, there are also these practical instructions focused on the patient's state.
Like the one saying, keep the patient as still and comfortable as possible.
Yeah, seems simple but important, right? Helping manage anxiety, physical discomfort before a major event. It also covers the practical stuff, taking out dentures, jewelry, contact lenses.
Standard surgical prep, yeah. Anything that could get lost or cause issues.
And pre-op washing, asking the patient to shower with a special chlorhexidine soap if there's time, or a sponge bath if not.
That's for infection prevention, reducing bacteria on the skin.
Exactly. Then providing the proper theater clothes, getting you physically ready in that sense.
And then there's the paperwork side of things, forms to fill out.
Yep. It mentions the patient or family completing the pre-anesthetic form. That's usually a detailed questionnaire for the anesthetist. And the patient needs to sign the hospital permission form, ideally with family witnessing.
The necessary admin and consent pieces.
Got it. And then right before the patient actually moves to the operating theater, there's one final really critical safety check mentioned.
What's that?
The protocol says, confirm which procedure is to be done on what site. Compare this with the patient, family, and theater list.
The final verification. Checking with everyone involved, the patient, the family, the official schedule, exactly what surgery is happening and where on the body.
It's a crucial triple check. A vital safeguard against wrong site or wrong procedure errors. Really emphasizes safety right up to the last minute.
Puts the patient and family right in the loop for that final confirmation. That feels important. Okay, so all the prep's done, checks are complete. Now it's time to actually go to the theater.
Right. And the protocol describes this transition too. It mentions that the family is encouraged to accompany the patient to the entrance of the theater complex.
So they can stay with you for a bit longer. That's thoughtful.
It is. And again, with the specifics, it even notes the procedure will happen in Theater 15, helps orient everyone.
Knowing the exact room number.
Okay.
And after the surgery.
The document gives possibilities for where you might go next. Cardiac HCU, ICU, or back to Ward 9. High care unit, intensive care unit, or a regular ward.
So that indicates different potential levels of care needed right after the operation, depending on how things went and how complex the surgery was.
Exactly. And it also thinks about the family waiting during the surgery. It tells them where to wait, waiting area adjacent to the theater complex, and reassures them that Dr. Weir will come speak to them there afterwards.
Good communication plan. Reduces some of that waiting anxiety for the family, hopefully.
You'd hope so. Now, it's worth remembering that this whole admission protocol, as detailed as it is just one part of the patient's journey.
Right. You mentioned it refers to other protocols.
Yeah, briefly. It mentions things like a general postoperative protocol, one for blood pressure monitoring, a specific postoperative protocol probably detailing care after this type of surgery, and even a specific discharge protocol for when you go home.
So this document we've been looking at is really just the first chapter, setting the stage. It plugs into a whole series of other plans for your recovery and discharge.
Exactly. It fits within a much bigger framework of care throughout the hospital stay.
Okay, so let's step back a bit. We've gone through this admission protocol from Dr. Weir line by line almost. What are the big takeaways from this deep dive? What does it really tell us?
Well, I think it really hammers home the incredible level of uh, deliberate planning and detail that goes into getting a patient ready for elective surgery. It's not haphazard at all.
Yeah, the specificity is striking.
And the focus on safety at multiple points from that initial ID check right through to the final confirmation before theater. It also shows how procedures are tailored. Not every patient gets every test or intervention. It's based on the surgeon's judgment for that specific case.
It definitely changes the vague idea of getting ready for surgery into something much more concrete, doesn't it?
Hmm.
Seeing the exact fluid rates, the hourly vital checks, that critical warning about the limp.
Right. The forms, the checks, the cleansing, every step has a clear purpose, contributing to safety and making sure you're in the best possible state for the operation.
What really stands out, I think, even though this document is basically a set of instructions for the hospital staff,
Yeah.
is what it implies about how everyone has to work together.
Yes. The coordination needed. That's a huge point.
This protocol doesn't just happen on its own, right?
Right? Not at all. Think about it. You've got nurses doing the checks, giving the fluids, maybe prepping the skin. You've got the anesthetist involved way before, assessing you, prescribing meds, lab techs running blood work, maybe radiology involved, the theater team preparing.
And Dr. Weir, the surgeon, overseeing the whole plan.
Exactly. Making a protocol like this work smoothly requires really seamless communication and handoffs between all these different people and departments. Everyone needs to be on the same page.
It's like a complex dance, isn't it?
Yeah.
All these different steps and people moving in sync following this detailed script, all focused on one patient's safety and preparation.
A very intricate system working behind the scenes, and it really makes you think about the sheer amount of coordination involved in healthcare, something we probably take for granted.
Definitely something to ponder the hidden choreography that makes complex procedures possible.
Indeed.
Well, thanks for joining us on this fascinating deep dive into the pre-surgery process.